Hello, my name is Morgan Boyles, and today I will be talking about adding a personal touch to our healthcare system. Healthcare is something that is used by everyone at some point in their life. What is healthcare specifically? Healthcare is efforts made to maintain or restore physical, mental, or emotional well-being, especially by trained and licensed professionals. With everyone using the healthcare system, including myself, and I'm sure many of y'all, we want our healthcare system to be at its best. There are many ways to do this, including adding a personal touch into our healthcare experiences. Healthcare now. Healthcare has changed a lot throughout the decades and even more in the past couple of years. In 2020, COVID hit and changed healthcare and everyone's way of life. We all went from being around each other all the time and spending time together to being cooped up in our houses and not being able to communicate very well. Not only did we use the personal ability of being around one another, we lost many personal experiences. COVID had a big impact on our healthcare system and on people's individual health, whether that be physical or mental. With doctors and nurses having so many patients while working at understaffed and hectic hospitals, our healthcare system needs to be relooked at and evaluated again. Increasing numbers. During the pandemic, patients in healthcare facilities increased tremendously. When that many people were admitted to health hospitals, doctors and nurses could not keep up with each patient individually and personally. Patients ended up just becoming a chart number and lost the personal relationship with their healthcare workers. Many patients couldn't be with their loved ones and craved someone to be with them at that time. Many healthcare workers now are burnt out and struggling with their mental health and the effects from working in hospitals during the pandemic outbreaks. What is healthcare with a personal touch? A personal touch in healthcare really comes down to going the extra mile to show that you care about your patients. Healthcare workers need to be able to put in that extra work and time and not treat their patients as just a chart number. When patients feel that their healthcare provider is genuinely interested in their well-being, they are more likely to feel satisfied with their healthcare experiences. By building this trust and relationship, patients are more likely to be comfortable discussing their health concerns, which can lead to healthcare providers to better understand their patients' needs and develop more effective treatment plans. The effect healthcare workers have. When you work in the healthcare field, most of the patients you meet every day are in pain, stressed out, angry, or not at their personal best. I know whenever I personally go to healthcare facilities, I am usually not feeling well and not the nicest and at my best ability with other people. The way a healthcare worker behaves with a patient is really important. The way a healthcare worker treats the patient usually helps to determine their overall experience. The ability to form a trusting relationship with those you work with will become one of a healthcare worker's greatest assets. According to a report in the U.S. News and World Report, a healthcare worker with a good bedside manner can make a measurable difference in the health of their patients. There are many different ways to add a personal healthcare experience. One is face-to-face healthcare. Some people prefer face-to-face healthcare, and in certain situations, it may be required. In face-to-face healthcare, you can do a physical exam and run diagnostic tests immediately when being with the patient. Also, in some cases, urgent or emergency care requires immediate attention, like going to the emergency room at night. Some medical conditions or treatments can only be done in person, such as surgery or physical therapy, where face-to-face healthcare is required in those situations. Face-to-face healthcare also might be better when providing mental health care. When providing mental health therapy or counseling in person can provide a safe place and private for the person to express their emotions and receiving treatment and support. Some people might not have the best experiences at home and might need to go somewhere to see somebody in person to be in a safe space to open up about their health concerns. When being in face-to-face healthcare, the healthcare provider may be able to pick up on nonverbal clues and body language that cannot be seen over a screen as well. There's another different type of personal healthcare, such as telehealth. Telehealth is the delivery of healthcare services and information through telecommunication technologies. Telehealth enables healthcare providers to remotely connect with patients to provide medical care information from a distance. During COVID, telehealth really became a very known thing when many people did not want to get out of their homes and go to hospitals where there are many sick people. Telehealth allows for improved access by overcoming geographic barriers and enabling healthcare to patients in remote areas. Telehealth is something that can be used to really help people who are far away, which is really nice. Telehealth helps to reduce transmission of infectious diseases. By not coming to see a healthcare worker in person, they allow to not risk spreading the disease to other workers and staying home and safe. Telehealth can be very cost-effective by being less expensive than in-person healthcare, reducing costs associated with taking off of work and the time of traveling from there as well. Some people, especially in mental health, will find a therapist who is about 2 hours away. They don't want to have to travel that far, so being able to do virtually will really help some people with their mental health. Telehealth helps to manage chronic conditions and provide remote monitoring and care condition. Telehealth is very helpful, especially with older people who do not want to get out of their home, and it is a lot harder for them to get out of their home to still be able to communicate with their doctor and have checkups. Some of the downfalls of personal health care is that they may not have the same level of expertise as professional health care and may not have the same level of knowledge or equipment. Many big hospitals will have specialists for different areas of the health field, where many local hospitals will have to modify patients to these hospitals to get treatments. Personal health care can be biased and influenced by personal beliefs or preferences to the caregiver. Some healthcare providers can be stuck in their ways and opinions may not be open to the new advances in the medical field today. With being in remote areas, sometimes they're not up to the latest things with all that is going on in our health field and the latest advances, and you might not be able to see that as a treatment plan by just going to your local hospital. Some more downfalls of personal health care is personal health care can have a lack of resources. Some personal health care may not have the same resources as professional health care, which can limit the range of treatments available. Many local clinics will send patients to a hospital depending on how bad their patients' injuries are. I know at many of my local clinics in my area, you can't even get an MRI and have to be sent to a hospital that is about 30 minutes away just to have an MRI. Personal health care can also take longer and require healthcare providers to maintain relationships that some might not want to maintain. Many healthcare providers had to stand bedside patients when they were dying in the time of the COVID pandemic. Some workers saw many people pass away without any family by their side. Sometime with personal health care, you are that patient's only outlook and care for them, and you need to form a very close relationship. So in conclusion, healthcare is something to be taken very seriously and should be done to the best of our ability because everybody is using our healthcare system. By using personal healthcare, we are able to build a trusting relationship with the patient and make them feel comfortable. There are also many ways to do personal healthcare as well, such as face-to-face and telehealth that I've shown as examples. While personal healthcare may have some downfalls, it also has many benefits to help our patients' needs. I think that by adding personal healthcare to our healthcare system can really help a lot of people with opening up and getting better medical help. My name is Morgan Boyles, and my presentation is called A Personal Touch. Thank you.